O3 deep research just cleared a real clinical hurdle. OpenAI and Boston Children's Hospital published in NEJM AI. The model-assisted diagnosis in 18 previously unsolved pediatric genetic cases out of 376 they ran it against. One patient, Kyra, had been seeking answers since age 9. She got her diagnosis at 28. That's the story. Here's what actually happened. Between 2024 and 2025, Boston Children's Hospital ran a 3-deep research on 376 cases of pediatric genetic disease where standard workup had failed. These are hard cases, the kind that exhaust specialist networks and genetic counselors. 18 of those cases returned a clinically plausible genetic mechanism the human clinicians hadn't identified. That's a 4.8% positive yield on a population of treatment-resistant unknowns. Kyra's case involved a rare biallelic mutation. O3 flagged it. The diagnosis was confirmed through orthogonal testing. She has treatment options now. The study is peer-reviewed and published. That matters. This isn't a vendor benchmark or a lab result. This is institutional validation from a major children's hospital using standard clinical protocols. The model didn't diagnose independently. It augmented the diagnostic workflow. Specialists reviewed the findings. That's the constraint you need to understand. Medical AI adoption requires human expertise in the loop, not replacement of it. Why this matters for AI builders. First, this is one of the first real-world validations that frontier LLMs can handle specialized medical reasoning at clinical scale. Second, it proves the bottleneck isn't model capability. It's institutional trust and workflow integration. You can build the best reasoning engine in the world, but if hospitals can't integrate it into their existing processes, it doesn't ship. Third, this signals a viable business model. Not AI replacing radiologists or geneticists, but AI augmenting their decision-making on cases that would otherwise remain unresolved. What to watch? Reproducibility is the next test. Does this yield hold across different hospital systems? Do other rare disease specialties see similar results? If O3 maintains a 4 to 5% diagnostic recovery rate on undiagnosed cases across 3 or 4 major medical centers, that becomes operational reality, not research novelty. If the yield drops below 2%, institutional adoption stalls. Build the system, automate the rest.